Right.
Oh, no. Yeah, no, you're good. No, no.
Because I cheat. Okay.
All right.
No cheat sheets on here today.
I actually watched a whole presentation like that, and no one told the presenter.
Oh, no. Yeah, no, you're good. No, no.
Because I cheat. Okay.
Oh, it's mimicking. I think, Devin, are we live now?
No cheat sheets on
Yes,
here today.
we are live on YouTube because Karina brought up that good point.
I actually watched a whole presentation like that, and no one.
We can hear ourselves.
Oh, hold on, let me pause it. That's why.
I think you have to lower the volume or something that way.
You might be right about that.
Yeah, it's just the feedback. Because it's delayed.
Mm-hmm.
I will be right back.
There we go. Oh, Marcela Vasquez is coming in. Okay. Morning, Marcella. Or almost afternoon. We're 1 minute. Oh, it's 12 now.
There it
So
is,
good afternoon,
right?
everyone. Then we have Dennis coming in. Morning or good afternoon, Dennis. All right, everyone.
Good afternoon. How are you, Devin?
Terrence Adams here with MD Anderson Cancer Center. I know he has a great presentation set for us to go. It's going to be very laid back, so feel free to ask any questions that you may have. Just raise your hand or use the little raise hand symbol thing, and we'll be happy to address any of your questions. But now I'd like to introduce Terrence Adams.
All right, so good afternoon, everyone. Like Devin said, I'm Terrence Adams. I'm a community health educator here at MD Anderson Cancer Center. So before I begin, I just want to let you guys know that I am at home, but if I were on campus at the hospital,
Sorry.
We're 1 minute. Oh,
Sorry, hold on about the feedback. Sorry about that. Okay.
Oh, it's okay. No, but if I were on campus at the hospital, I would have a mask on. So just to let you guys know, we are still wearing masks at MD Anderson Cancer Center. This is very informal, so please feel free to stop me at any time if you have any questions. So before I begin, I just want to let you guys know that COVID-19 does still exist. It is still real. We want to make certain that we're practicing safety. So make sure that you are practicing social distance, stay 6 feet apart as much as possible. I know that the state of Texas is open, but anytime you go anywhere, try to practice social distancing. Continue washing your hands. So even beyond COVID-19, hopefully that's a practice that we've all picked up and continue to use. So continue to make certain that we're washing our hands. Wear your mask. That can actually help as well. So make certain that you have your mask on. Like I said, right now, I'm in a room by myself, but if I were in a room with someone else, I would definitely have my mask on. And then also make certain that you get tested. So if you feel any symptoms or anything that may make you think you have COVID-19, make certain that you do go get tested. Time is of the essence when it comes to COVID-19, as we're learning. So today we're going to talk about colorectal cancer. And so we got a little COVID-19 spill out the way, so now we can talk about the presentation. So colorectal cancer, the things that we're going to go over today, one thing we're going to go over is colorectal cancer facts. So I want to make sure that you know the facts about colorectal cancer. I also want to make certain that you know that the risks that are associated with colorectal cancer. And then finally, and most importantly, I want to make certain that you guys know that you want to get screened, when you should get screened, and make certain that you're participating in screening. So colorectal cancer is a cancer that you want to make certain that you're getting screened while you're healthy. More than 90% of people can beat colorectal cancer if it's found early. So if they find colorectal cancer in its early stages, it's easier to treat. But the main thing you want to pay attention to is that you are getting screened when you're supposed to, and that you're getting screened while you're healthy. It's easier for them to treat it at that point. than it is when you start to have issues. So what is cancer? So a general answer of cancer is that cancer is an uncontrolled group of abnormal cells. So if you think about a slice of bread, for example, right? Sometimes we have bread and it may have mold in it. So that reminds me of this picture. So the square cells are your healthy cells, and the circular cells, those are your abnormal cells. So what happens with cancer is sometimes you'll have a group of abnormal cells and they'll form what's known as the tumor. So the tumor can form, and then at that point, that's when doctors want to look at it to make certain that it's either cancerous or non-cancerous. So a lot of times they'll say benign or malignant, but they just want to make certain that the tumor is cancerous or non-cancerous. At that point, if the tumor is non-cancerous, it's up to your doctor whether or not if they want to remove it. But if it is cancerous, obviously we do want to treat it. One of the things you want to pay attention to with tumors when you have cancer is that sometimes what happens with the cells is that they can actually move to other parts of the body. So for example, someone may have lung cancer, but the cells may move to other parts of the body, and then it may go to like your stomach or things of that area. Just because you feel it in a new area doesn't mean you have a new type of cancer. They're still considered lung cancer. It's just that it's spread to other parts of your body. So wherever the primary site is, those are the cells that they're trying to treat. So keep that in mind when it comes to cancer. And so let's talk about the colon and the digestive system. So the colorectal cancer is anything that deals with the digestive system. So anything that deals with food from the breakdown to actually exiting the body. So what you want to pay attention to with the colon, if I were out in the community, this is a part that I love to illustrate, but the colon itself is actually 6 feet long. So if you see this large tube on the outside, if you took that and stretched it out, it would be 6 feet long. So that is the part of your body where food travels through as far as digestion is concerned. The rectum is the area where the food exits the body. So that's where we start to get rid of waste and things of that nature. So anything that deals with that system along that path, that's considered to be colorectal cancer. And so one thing we want to make certain that people know when it comes to colorectal cancer is that there are risk factors associated with colorectal cancer. There are some risk factors that you control, and then there are other risk factors that you can't control. So we want to make sure that you pay attention to your risk factors. The first risk factor is your age. So 50 or older is when they start to find most colorectal cancer cases. In fact, my notes say that at age 55 or older is when they find 3 out of 4 cancer cases. When you look at different groups, in particular African Americans, they actually find colorectal cancer at a younger age. And so Chadwick Boseman, I don't know if you guys know him or not, but he played Black Panther. This is the actor that passed away at like 43 from colorectal cancer. So he actually put a huge spotlight on the fact that, African Americans are dying at a younger age and they're actually diagnosing it earlier. You also want to pay attention to your personal or family history when it comes to colorectal cancer. So a lot of times you want to make certain that you're finding out what people die from. So a lot of times we just assume like this person died because they were old, but they may have died from a certain type of cancer. And then that could increase your chances of getting that cancer. And then also you want to pay attention to the fact that if you grow up in a house, so say for example, with your parents or your siblings, you tend to eat the same way, you tend to have the same type of nutritional habits and things of that nature. So if a sibling or a parent was diagnosed with colorectal cancer, there's a high chance that you could also, because you have that same diet, be diagnosed with colorectal cancer. We also tell people to pay attention to a personal or family history of Lynch syndrome. So Lynch syndrome is actually a condition where individuals have a lot of polyps, and we're going to talk about polyps in a few minutes, but individuals tend to have a lot of polyps in their colon. So polyps look like pimples, if you will, but they're inside the colon. So this condition is something where people have a lot of polyps, and so as a result, they have to go get colonoscopies on a more regular basis. And you definitely want to pay attention because there could be a group or a cluster of polyps that could actually form a tumor. So this is something you also pay attention to. And then finally, you also want to pay attention to inflammatory bowel disease. So anything that causes inflammation in your colon, you definitely want to pay attention to that. Things like ulcerative colitis or Crohn's disease are some examples of things that cause inflammation in your colon. So, once you're experiencing those can actually also increase your chances of getting colorectal cancer. So we're going to come to a interactive portion of this presentation, and we're going to look at this question. So if you don't mind, click thumbs up if you think that eating processed meat increases your risk of colorectal cancer. So do the thumbs up symbol. Yeah. So I see a lot of thumbs up, and I see a couple of people who are like, I love processed meat. So unfortunately, processed meat can increase your chances of getting colorectal cancer. So you also want to pay attention to your diet as well. So one thing we talk about is paying attention to your weight. Being overweight or obese can also increase your chances of getting colorectal cancer. And obesity is actually associated with at least 9 or 10 different cancers. So you want to make certain that you're paying attention to how much physical activity you're getting per week, your nutrition, make certain that you're eating your vegetables and things of that nature. And we'll talk about that again at the end. And then, like I said, a diet that's high in processed and red meat or meat that's cooked at a very high temperature. So the reason why these are considered to be risk factors or increase your chances of getting colorectal cancer is because those tend to sit in the colon longer, and it takes your body longer to digest that. So especially meats that are cooked at high temperature. So when you think about fast food and how you order something at a drive-through kiosk, and then 3 minutes later, actually, it's ready. So they're cooking it at a very high temperature. It can sit in your colon for a longer period of time than fresh food and things of that nature that move through quicker. And then finally, we want to make certain that we're not smoking and that we don't have excessive alcohol usage. So if you do smoke, MD Anderson has programs that will actually pay you to stop smoking. So they do have research programs that you can participate in that can help you kick the habit. And then they also have programs where, like, sometimes people are saying, well, I've been smoking forever, I've tried everything. So they have many different programs. So if you do smoke and you want more information about that, just go to mdanderson.com and look up those programs. And then also excessive alcohol usage. So you want to make certain that you pay attention to how much alcohol you consume. For men, they say we can have 2 drinks per day. For women, they can have 1 drink per day. So you want to make certain that you pay attention to that, and don't just save all your drinks for 1 day a week, but just make certain that you're paying attention to how much you are consuming. So as far as colorectal cancer is concerned, there are different ways to get screened. Here at MD Anderson, we consider the gold standard of screening is colonoscopy. So the colonoscopy is considered the gold standard of screening because it does 2 things. 1, it can help detect cancer early, and 2, they can remove polyps during the colonoscopy. So if they see any abnormal cells or polyps during the procedure, they can actually remove it. And then, like I said, it can help determine if you have colorectal cancer at an earlier stage. Most people complain about the colonoscopy, but to be honest with you, the part that I hear the most complaints about is the colonoscopy prep. So this is the portion where you have to clean your colon. So probably 2 to 3 days before you actually participate in your colonoscopy. So 2 to 3 days before you participate in your colonoscopy, you're going to have to make sure that you clean your colon. This means drinking clear liquids. So I just drank water, correct? So pretty much the clear liquid I know is water. So the only thing you can drink for 2 or 3 days is water. Making certain that you don't eat solid foods. You're going to pay attention to your doctor's orders. Most doctors will tell you 24 hours or so before your colonoscopy, don't eat any more solid foods. And then you're going to have to drink a large volume of cleansing solution. So this is the portion that has actually, from when I went out into the community, I found that it's gotten better over the years because now they have flavors when it comes to the cleansing solution. So you can get like Southern sweet tea or things of that nature. But the cleansing solution is basically like a gallon of this solution, and you have to complete the whole thing and make sure that you cleanse your colon thoroughly before coming in to do the procedure. Remember, they can't do the colonoscopy until your colon is completely clean. And like I said, you're going to follow your doctor's instructions. So when I talk about this portion in the community, this is where people just chime in and say, well, my doctor told me I don't have to eat for like 12 hours. And then someone else will say, well, mine said 3 days. But you just want to make certain that you pay attention to what your doctor tells you. Now, the actual colonoscopy itself, like I said, it's not that bad. The main reason it's not that bad is because they give you medicine. So you will pretty much be asleep during the whole process. So they usually give you medication to relax while they do the procedure. Once they start with the procedure, it's basically a thin tube. It has a light and it has a camera, and they actually go through the entire colon, and they don't go through the entire colon, but they go through like 4 or 5 feet, if I'm not mistaken. And they go through and they look for polyps and any type of abnormal cell. So if you look at this picture here, that thing that's like hanging down, it looks like a pimple, that's considered a polyp. So if they see a polyp in the colon, they can actually remove it during the colonoscopy. They can also take tissue samples during the colonoscopy as well. So the colonoscopy itself, it lasts 15 to 30 minutes. So you probably have 48 hours of prep for 15 to 30 minutes of the procedure. And then, like I said, during the colonoscopy, they can remove polyps. They can test. If they see anything abnormal, they can take a sample of it and test it to see if it is cancerous. So at this point, I'm actually going to stop share. If anybody has any questions, please feel free.
We do, Terrence, we have a question about the meat. And it says, does this include grass-fed or organic meat?
So that is a good question. That's one of these modern day questions where we go to the grocery store now and, everybody's selling organic for $10 and $15. So as far as red meat is concerned, red meat is pretty much red meat. Now, the leaner the cut, the less fat you're going to take in and things of that nature. But it still takes a little time to digest that and to get it through your system. It also matters how you cook the meat. So again, if you're cooking it at high temperatures or if you're cooking it in grease or things of that nature, you have to also pay attention to that. Go ahead, Jeffrey. I'm sorry, you're on mute.
No, I had to unmute myself. I was like, oh, where's my unmute button? So you're talking about the temperature. I don't eat beef or pork at all, so it doesn't really matter.
Congratulations.
Yeah, I eat chicken breast and that's it. I'm a picky eater, so I'm not so fun to go out to dinner with. But anyway, my husband loves his red meat, but doesn't eat it often. But he actually gets it cooked rare to medium rare. Is that actually better than getting it more cooked? Or you know what I mean? I'm just curious,
So I am not 100% certain about that question because I've actually gotten that question before. The main thing we try to tell people, so once I get later in the presentation, because the thing that you get cooked rare is a steak, correct? Right. So the thing about the steak is it's not as important as how you get it cooked, as important as how big the steak is. So your steak should be the size of your fist, correct? Yeah. But let's be real, who's going to go to the steakhouse and get like a 4-ounce steak? So that's the most important thing, is to pay attention. How much are you ingesting? So if I get a 16-ounce, obviously that's more in me versus if I, get something, and how it's cooked. So that's the more important thing to worry about.
Cool, thanks.
That was my question too, because of course, well, as a woman, I eat rare meat, but also my boyfriend, he eats rare as well. I mean, we eat it cow still mooing bloody. And so, I just wondering, and then of course, eating we eat sushi. Does that have anything to do with like eating raw fish?
So fish is considered red meat. Unfortunately, I can't eat seafood due to a allergy, but fish is actually considered to be safer and healthier. But like I said, it's not red meat, so it doesn't take as long to digest as, say, for example, a steak or a hamburger or like pork chops.
That makes sense. Okay. I was just curious. Thank you.
So is there any other food? What if you don't eat meat? Is there any other food then that maybe I'm eating that could be something that could?
So like people who don't eat meat, y'all are like my heroes, but I'll say this much. As far as like your processed snacks, things of that nature. Yeah, so things that are like packaged and usually taste really great, you know.
Well, I knew I wasn't perfect. There's my downfall.
Yeah, so you know, your snacks, things of that nature, your chips, those are things that like have a lot of preservatives in them so they can stay on the shelf longer, which means that they're most likely going to stay in your body a little longer as well. So
like cheese and stuff like that too, correct?
stuff we love, correct.
The most delicious stuff in the world, cheese. Yes, okay.
So we had talked about the colonoscopy. I'm actually going to share with you guys a video about the colonoscopy that explains what happens when you get your colonoscopy.
So, your doctor told you it's time to schedule a colonoscopy. You probably have some questions, like, how much liquid do I have to drink? Do I need to stay close to the bathroom? Is this going to be embarrassing? Okay. Want to know what to really expect your first time? First of all, you can't eat any solid food the day before the procedure. You can only have clear liquids, and your colon needs to be clean and smooth, like the palm of your hand. If it's not totally clean, you may have to repeat the procedure. So drink all the laxative solution your doctor gives you, every bit of it. Let's be honest, this next part kinda stinks. Your colon is clean when nothing but clear liquid comes out, and that might take a while. As for the procedure itself, you'll be under sedation, so you won't feel a thing. But just as an FYI, the doctor will inflate your colon with air or another gas and insert a very tiny camera to look for abnormalities. During the procedure, the doctor may remove polyps or take tissue samples for study. The procedure only takes about an hour. When it's over, to be released from the hospital, you need to pass one simple test. You won't be able to drive home, so be sure to arrange for a ride ahead of time. Most people feel fine after the procedure, and you can resume your normal diet if your doctor says it's okay. So for most 50-year-old men or women, it's time for a colonoscopy. That's about 7 in dog years.
So again, that's a video that explains how the colonoscopy works. Go ahead, Ms.
So, does it hurt? Okay, I have to ask this question because, no, not the procedure. My parents do it as a date. It's kind of cute. I think it's great. I have to pick them up. But when they go in and I see them removing this little polyp thingy, if they do remove or do any biopsies, do you have any pain from that?
So from my understanding, you don't. Like I said, you're sedated during the process. But when I've done this class in person, I've taught this class to a couple of nurses who said, I didn't want sedation. I want to stay awake the whole time. And they said they didn't feel anything like, I mean, you feel obviously the two, but
Nothing.
but you don't feel, it doesn't hurt. But I guess their medical mind wanted to stay up and watch the process occur.
You're so out of it. I've had it because I have stomach problems and I take medicine. So I started in my 30s because that's when I started having problems from other stuff. And it's really nothing. It really is absolutely nothing. The more annoying part is the cleaning yourself out. But even that, it's not fun. But I look at it as, hey, it's a great cleansing and maybe a little weight loss.
Yeah, I hear that all the time. You do lose weight as a result.
Devin, Terrence, we can see your notes on this one.
Okay, thank you. Thanks, Victoria.
There we go. Perfect.
Cool. All right. So hopefully you know the answer to this question, but just in case you don't, click the thumbs up button if you think everyone should get their first colonoscopy at age 50.
They still haven't made it sooner?
So they're working on getting it down to 45. I know the ACS recommends 45, but as far as standards are concerned, most people should get their first colonoscopy at age 50.
Right.
And so like we said earlier, African Americans tend to have colorectal cancer at an earlier age. So they can talk to their doctors about getting it at age 45. But for the most part, for your 50th birthday, you will give yourself a present and go get your colonoscopy. And so that'll be your first colonoscopy. And then, I know, right? But then if they find nothing wrong with your colon or, you have no real issues, you'll go back every 10 years, unless your doctor says otherwise. So you get your first colonoscopy at age 50, and then it's every 10 years following that point. Now, there are other screening options available as well. The most popular one is the stool-based test. So we've all seen the Cologuard commercials and things of that nature where these are tests that you can do this screening at home. So basically what you do is you take 3 different samples of your stool at 3 different times. I know that sounds gross, but you take 3 different samples of your stool at 3 different times. You send it into a lab, and basically they test it to see if there's any blood or anything in your stool. Obviously, if there's blood, that could be a sign that there may be polyps, and then they may call you in to actually do the colonoscopy. Go ahead, Ms. Carrick.
And do they have any type of prepping for this one? Because I mean, I'm just going to be flat out honest here. We're talking about rear ends. I don't think people can poop 3 times a day at different times. If you're a regular scheduled person.
So most likely you would do this over the course of a week. So they just want 3 different samples because you don't want to take 3 samples from the same stool.
Right.
It's like
nothing like keeping your poop around, right?
Exactly. So you would do this over the process of a week. The good thing about this one is it doesn't require prep. So this is just you living your everyday life. And then I happen to take 3 samples, send it into a lab. So like I said, if they find blood, they most likely will call you in. That's when you would have to do the colonoscopy. But otherwise, if they don't, you're considered to be okay. These can be done once a year, every year, and usually they're done in between colonoscopies. So most doctors will say, just do this kit once a year, every year.
Can you substitute this one for your 50th birthday present?
Unfortunately, you cannot, because like I said, at that point, you want to make certain that they're going in, that they see if there's any polyps, if they see if there's any type of abnormality. So that's the best way for them to determine that.
So this is your upkeep in between the 10-year colonoscopy birthday present.
Yeah.
Gotcha.
And then another option. So the I guess the young person in me thinks this is cool, but virtual colonoscopy. So this is a process where they actually take a picture of your colon. So with this process, what you want to pay attention to is you still have to prep like you would for a regular colonoscopy, but the difference is you're going to drink a solution and they're going to use like CT scan technology to take a picture of your colon and see if they see anything that's abnormal. Now, 3 things I want you to pay attention to with the virtual colonoscopy. The first one is that you do have to prep the same way you would prep if you were getting a real colonoscopy. The second one is most insurance companies don't cover this because, it's pretty much like a real colonoscopy. It's just that it's not invasive. And the third one is that if they find something in your colon, you're going to have to come back and do a regular colonoscopy anyway. But this is another option to consider. Usually people do these like every 5 years in between the 10-year colonoscopy, if their insurance supports it and if their doctor recommends it. And so click the thumbs up button if you think that colorectal cancer does not have any warning signs. So if you think colorectal cancer is a quiet cancer or, one of the silent ones. Interesting. So there are warning signs associated with colorectal cancer, but I want to warn you guys before I go through these. These are also things that you would feel if you went to a restaurant or something and overdid it one night. So this is something that would happen over a prolonged period of time. So like a few weeks to a month or so, if you continue to have these issues, this is when you want to be concerned. The first one is rectal bleeding or blood in your stool or the toilet after a bowel movement. And so the reason why you want to pay attention to rectal bleeding or like blood in your stool is because that could be a sign of a polyp. So obviously if the waste rubbed against a polyp or something or cut it or anything like that, that may have been what caused the rectal bleeding. So you want to pay attention to blood in your stool or things like that. The second one is people who have prolonged diarrhea or constipation. So again, like I said, I could eat a bad meal and have this for like 2 days and be okay. There are some people who suffer with this for like 4 to 6 weeks. So you want to pay attention to like, if you're continuing to have that issue, that's when you want to address it. Change in the size or shape of your stool. So pay attention to how your stool looks, pay attention to the coloring, the size of it, things of that nature. And then just try to see if it stays as consistent as possible. Obviously, if there's changes, there could be something going on within your digestive system. And again, this has to be over a prolonged period of time. So like if one day, you happen to see something different, but then it goes back to normal, I wouldn't panic or like anything like that. And then a lot of people complain of abdominal pain or cramping in your lower stomach. So any type of pain that you have at your lower intestine, things of that nature, that could also be associated with it, especially if food or waste is there, but it's not able to exit the body. That may cause pain over a period of time. And then a lot of people say they have an urge to use the restroom, but there's no need to go or nothing comes out. So that's also an issue that people complain about over a long period of time is, I feel like I have to go, but nothing happens when I actually get to the restroom. And there are ways that you can lower your risk. The most important way that you can do that is, like I said, get screened and make certain that you get screened while you're healthy. It's easier for them to treat you and things of that nature. And then you just want to make certain that when you get screened, like I said, as long as you're okay, and for the most part you will be, you can return back to your normal life. Like the cartoon says, that next day. So you're back to your regular diet. You're back to everything that you were normally doing. So make certain that you get screened. Like I said, your 50th birthday present should be a colonoscopy. Make certain that you maintain a healthy weight. And the way you can do that is that you want to exercise on a regular basis. So try to get 150 minutes in of physical activity per week. That breaks down to 30 minutes a day, at least 5 days a week. You don't have to do the 30 minutes all at once. You can do 10 minutes in the morning, 10 minutes for lunch, 10 minutes, in the evening. But you want to try to get in 150 minutes of physical activity per week. You also want to eat a plant-based diet. So we heard a couple of people on here who already do that, which I think is great. So you want to try to increase your vegetables, your fruits, things of that nature. Try to stay away from all of the red meat as much as possible and just eat more fruits and vegetables. And like I just said, so limit your red meat, limit your processed meats. Like I said, those take longer to digest. Those sit in the colon longer, and those could probably cause more issues. And then you want to eat high fiber foods. So choose brown rice over white rice. Make sure that you're getting your wheat in, things of that nature. And as we mentioned earlier, don't smoke. So if you do smoke, I would just go to MD Anderson's website, see if you can find a program that may work for you, and limit your alcohol consumption. So like we said earlier, men can have 2 drinks a day, women can have 1 drink a day. And those are regular size drinks. So as far as finding screenings are concerned, these are finding screening services. So the first thing you want to do is contact your doctor's office. Make certain that you talk to your doctor. So if you go to a primary care physician, just let your doctor know, hey, I would like to get a colonoscopy. Most of us go to these like hospital systems where there's satellites and things of that nature. So they can usually send you to another campus if you need to get the colonoscopy. If that's the issue, you can go to community and county clinics. So I know in Houston, Harris County, LBJ and Bentob are the 2 safety net hospitals, and they do colonoscopies at both of those hospitals. They also have like a program where people can get on it if they have trouble paying for it. You can also come to MD Anderson Cancer Center. So you don't have to be a cancer patient to go to MD Anderson Cancer Center. We actually have a prevention center. So if you just wanted to go to make certain that you're not, to prevent cancer or to make certain that you're okay, you can go to the prevention center and they'll take care of you there. MD Anderson also has a Fit Flu program. So we have a program associated with different county clinics where people can go get a free Fit kit. So this is a kit that you would do at home where you would take your sample and then actually send that back to a lab. So there are a list of clinics, if you go to MD Anderson's website, where you can go get that kit for free. And then you can call 211 and they'll actually give you more information on where you could go get a colonoscopy. And then finally, you can prevent colorectal cancer. So the main thing we want you guys to do is talk with your healthcare provider. So if you're having issues, keep a journal of your issues write down your concerns. And then when you get to the doctor's office, share that with the nurse. She can let you know which ones are most important to share with the doctor right away. So if you're having like the diarrhea, the constipation, blood, things of that nature, just keep a journal of that and then let your doctor know. Know what your risks are. None of us looks the age that we are, but we know how old we are. So make certain that we pay attention to how old we are, that we're doing what we're supposed to do at the age that we're supposed to do it, and that we're getting screened, things of that nature, that we're participating in our fit kits on an annual basis, and that we're just making certain that we're looking out for the health of our colon. And then finally, encourage a family member or a friend or someone else to also get screened. So just let people know, I went and I got a colonoscopy. There's nothing to be scared of. Go ahead and go get yours as well. I know you can go get it. Just, get the procedure and get it over with. So like I said, these are ways that we can help prevent colorectal cancer. And so my last slide is just to let you guys know again that we are from UT MD Anderson Cancer Center. And if you guys have any questions.
I don't have any in the chat, so if anyone has any more that they'd like to raise their hand.
I know a lot of us were asking at the time they came up too, so.
Oh yeah.
Oh, sorry, I'm muted there.
Sorry, I had a barking dog. No, my questions you actually answered while you were going through your presentation, so thank you.
Oh, thank you. Well, you guys were my first virtual colorectal cancer class in like a year, so thank you guys so much for.
Wow, really?
Well, March Colorectal Cancer Awareness Month, so I guess people it wasn't on their brain until now. So.
Is it just like the one, I guess I'm sure there's several, the uncomfortable conversations to have on where you get cancer. And obviously this is something that it's that unspoken conversation. So thank you so much for having this today.
Like I said, colorectal cancer is one of the more common cancers, but it's also one of the ones that's easier to treat if you find it early enough. So.
Mm-hmm. Thank you, Terrence.
No problem.
Thank you so much.
Thank y'all. I'm actually going to turn it over to Devin, I think. I'm not, so.
Devin.
Well, thank you everyone for joining us today. And thank you, Terrence, for having that presentation for us. Your first colorectal one in a year. So we feel honored. Thank you very much. This link will be on YouTube. It is also on Facebook. And MD Anderson is actually going to be hosting a few more of these webinars now, I think through June or July. And our next one will be April 20th. And we will address cancer symptoms women should not ignore. So you can go ahead and register for that one now on our calendar, hwcoc.org/events. And you can see all the other ones lined up through till June. All
so
right.
Victoria is posting the survey link. Go ahead, Victoria, because that's your area.
Yes, the survey link is for you guys. It's just very quick. I think it's like one question, maybe two.
Easy.
And it just lets us know how we did and ways we can improve, and gives Terrence his thumbs up for actually presenting, and shows MD Anderson that, hey, we did our job today. So if you could